Now, for the politics of all of this, even the website, we turn to Democratic strategist Chris Kofinas. He's the former communications director for the John Edwards presidential campaign. Chris, great to have you on tonight.
Hey, David. How are you doing?
Good. So one could argue that fewer healthy people who enroll in health insurance could mean higher cost pressures on everybody else. But the ham-fisted way this report was put together, how does that affect what happens next in Congress?
Well, I think the political strategy that AHIP may have desired, which is to kind of slow down healthcare reform, may have just spurred it. And I think Congressman Wiener is right that this document, in a weird, perverse way, is I think given a lot of fuel to those public option advocates that are saying the insurance industry is basically telling you they are going to raise rates, and so the argument for a public option now I think becomes a little bit stronger. Now, part of the problem here is, you have the Baucus vote tomorrow. I think that's going to, obviously it's going to pass. The question is, does Senator Snowe vote for it or not? And then the real work begins in terms of getting these votes out of the Senate, out of the House, into the conference, then back to the House and back to the Senate for another vote. So there is still a long ways to go before this legislative process is over.
We heard Congressman Wiener talk about the website and the effort to reach out to conservative Democrats. Where is that headed in your estimation in terms of the effort by the more liberal Democrats to essentially count heads and see where the moderate Democrats are?
Well, I think in the House there's still, I think, a very strong desire to have a public option. I think you're seeing pushback in the Senate amongst, some conservative Democrats and obviously almost all the Republicans, if not every Republican, who oppose a public health care option. I mean, my argument and what I've been saying before, at the end of the day, I think the way to look at this politically is what solves the problem. And I think that is where you gain politically, both in the short term and in the long term. And if a public option helps drive down costs and expand coverage, which I think are the two key criterias to determining this policy being a success, then I think there's a strong argument to have a public option in there. And even though a conservative Democrat may face some short-term backlash, those constituents, those voters are going to thank them when their health care costs go down. I think that is part of the problem, is making those conservative Democrats buy that argument. It is not something that is easy to do given the politics they face in their own states.
Well, let's talk about the two issues you raised as far as driving down costs and expanding coverage. Let's say the insurance industry is right and that this bill leads to an explosion in health care rates. How disastrous would that be politically for the Democrats, even if they have expanded coverage? And do you think they're sufficiently aware of that possibility?
Well, I mean, listen, just to be brutally honest about it, if we pass dramatic health care reform and health care costs skyrocket, if this health care analysis by the insurance industry is correct, and I don't believe it is, but let's say for argument's sake it is, then you have a major political problem, because I think the overwhelming majority of Americans want health care reform under the assumption that, one, it's going to drive down costs as well as expand coverage to those who don't have it. And I think that is obviously the key thing that's motivating the White House and Democrats. I think this is where the insurance industry, in a weird way, may have just spurred even more significant health care reform as this legislative process moves forward. And you're going to start seeing a lot of people say, wait a second, we need even more checks on the insurance industry, given what they're basically telling us they're going to do.
And speaking of the White House, President Obama has not taken a very adversarial approach to the insurance industry. Is this new report his vehicle to do it, and would it be wise?
Well, I mean, he's been I think, kind of critical of the health industry, and they've pursued a strategy of trying to get as many of the major players involved. And you saw the insurance industry in the beginning say they were supportive, except when it came to the fact that they may not make the profits they desired, and all of a sudden they're not so supportive. I think what you're going to see is the White House, I think, be much stronger, much more vocal against not only these claims in this report, but against this notion that somehow we don't need health care reform. Because at the end of the day, it's pretty clear what the insurance industry wants: health care reform on their terms. That is not going to be good health care reform for the country. I think we need health care reform that's good for the country, not for the insurance industry.
Democratic strategist and former John Edwards communications director Chris Kofinas. Chris, thanks as always for your time. We appreciate it.
Thanks, David.